It's the 6-month mark since the national health care overhaul was signed. And starting tomorrow, some provisions of the new law kick in. Some examples: adults can keep children on their health plans until the age of 26. Insurers can no longer deny coverage to children with pre-existing conditions. Co-pays are eliminated on preventive care like mammograms, flu vaccines, and some cancer screenings. But Minnesota Governor Tim Pawlenty is not impressed. He joins us live. Good evening, Governor.
Good evening, Greta.
Governor, I know you don't like the national health care bill. Is it that you don't like it because of philosophy, in the sense that, the government shouldn't be so involved in people's lives, or is it or do you see it as a fiscal matter causing a burden on your state, or both?
Well, I see it as a bait-and-switch campaign. We had a health care crisis in America. It's largely, Greta, a cost crisis. President Obama promised to fix the cost crisis, and all he did is expand access to a broken system. For example, those things you just mentioned are mostly good things, Greta. We should include those in health care reform, but they didn't make the other changes necessary to hold down costs. There are reports out now that the premiums in the private markets next year are going to go up 10 to 25%. An extraordinary increase, one of the largest we've had in recent years, and the people who are providing that insurance are citing ObamaCare as the main reason. They didn't do the hard work of fixing the system. They just added access to a broken system.
Well, as I understand it, Governor, the whole way that this was going to be deficit neutral was with the mandate, meaning what every American was going to have to kick in or buy, that was going to fund it. And that would sort of solve the problem. Unfortunately, that doesn't kick in until, I guess, 2014. So are you telling me that what begins tomorrow has a cost? Because if it does, I'm trying to think of where are we getting the money for this. To what extent, let me ask you this simple question. How much is it going to cost Minnesota, do you think, in the next 6 months, if at all?
Well, let me just back up one step, if I could, Greta. Don't confuse deficit neutral with costing less or the same. This thing's going to cost more. Nobody debates that. They're just saying they paid for it. In fact, they didn't. They cooked the books. So first of all, it's not in the long run going to be deficit neutral, but they're increasing the overall cost of the system. And then secondly, they didn't do the work of fixing it. It's going to cost states like Minnesota a lot. Just on one small piece, had we early enrolled in this system, it would have cost us as much as $400 or more million just in the first few years for one piece of it. But we should have done those things in this reform that put market reforms in place, not government-centric reforms in place. They didn't do it.
All right, this $400 million, now, there was an executive order that you issued, which you said that you wanted to reject some of the federal funding. Is that correct, sir?
That's right.
All right. Now, why did you reject that? And and I know that the Secretary of Sebelius has said basically, that that's going to be a tough break for the people of Minnesota.
Well, first of all, let me give you a total of what we've rejected just by way of example. We were one of the few states that could early enroll in this thing. We chose not to because it was going to cost us a boatload of money. Number two, they were willing to give us some money to create a state high-risk insurance pool. We already have one, and it's better than the one they were offering us. We didn't need their money. We don't need to waste more money on that. We've already got one, and it works well. Three, they wanted to give us money to study insurance exchanges. We told them we don't want their money because we already studied that 2 years ago and concluded they don't work, at least as to containing costs. So they don't have any money. They're broke. They're borrowing it from the Chinese, and yet here they come offering us money, A, that we don't want, and B, we don't need in many cases. And so we said we're not taking the money unless it's something we were already going to do anyhow or consistent with what a state priority or state initiative would be.
Could you have taken them? I mean, were there strings attached? I mean, if the federal government was saying that this is how you had to spend the money, not that I'm trying to tell you how to swindle the federal government out of money, but I mean, were there strings attached so that you could have taken the money and used it in other areas of health care in Minnesota, for instance?
No. They offer you a teaser rate. So, for example, we could have gone into early Medicaid enrollment for our single adults without kids, and they say, yeah, if you come in early, we'll pay for all or most of it in the near term, and then over time we'll kind of back off that commitment, and you'll have to pay more and more of it. So it's like these adjustable rate mortgages, and reminds me of some of the old mortgage storefront mortgage companies offering the teaser rate to get you in the door. And we weren't interested in that. And that's just one example of many. But the bottom line, Greta, is for most Americans who have private insurance, one of the main measures of whether this is going to be successful or not is their insurance going to cost more or less? And as to increased costs, is it going to be reasonable? And what we're seeing already is the insurance companies in the private market saying there's going to be extraordinary cost increases, and a big chunk of that is because of Obamacare's failure.
Is there any way to control what the insurance companies can charge?
Well, we have all kinds of mechanisms to do that, but I think the best way to do it is competition. I'll give you just one example. We should have the federal government allow the states to sell health insurance across state lines. I can go on the internet tonight and buy my life insurance, my car insurance. I can buy anything I want on the internet across the country. Why the heck am I limited to basically 3 choices of health insurance in Minnesota? Why can't I buy from California, Greta? Why can't I buy from Florida? Why can't we get those companies competing against each other with safeguards for consumer protection, minimum quality measurements? Those are the kinds of reforms that would save money, and they won't even allow that. Why didn't they do medical malpractice reform? That would have saved money right off the top, and there's a bunch of stuff they could have done on a bipartisan basis. Instead, they jammed this partisan bill down the nation's throat on a completely partisan agenda.
Governor, thank you, sir.
You're welcome. Thank you, Greta.
Next, former First Lady Laura Bush goes on the record. Now, why is she talking about tea parties? And why is she joining forces with President Bill Clinton? This is